And when I was 15 years old, my father called me and told me my sister had died. And I told him on the spot that I wanted to be a physician. Nobody in either side of my family had ever become a physician, but I was driven since that age to want to pursue medicine. And I think the reason I did was that I wanted to make positive differences in people's lives, like my sister and my family. I had just come from a system in which everybody was getting coverage. There were no differences. If you were a private or a general, they all had access to health care. Our focus was to keep them healthy and to keep them well. There's a story that really motivated me, and I actually mention it in chapter 1 of the book. And the story goes like this. If you take a frog and you put it in water and you slowly turn up the temperature, the frog will boil to death. But if you take the frog and you throw it into a pot of boiling water, it'll immediately jump out. And what I recognized was that I was the frog. I had been thrown from a functional, fully integrated healthcare system into a dysfunctional, fragmented, unaccountable, broken healthcare system, and I decided to jump out. So it was that I think motivated me to do something, to write something about our healthcare system. And I contend that if that hadn't have happened to me, and I'd come right out of residency into practice, and slowly had the temperature turned up on my pot of water, I would have been oblivious to it. I went in 2008 to a healthcare reform debate that was happening here in Boise. This was after President Obama had been elected, and both the United States Senate and the House of Representatives were contemplating healthcare bills. And so we had a forum here in Boise in terms of the discussion of concerns and questions and issues around healthcare and what needed to be changed. And what I didn't know is, it was on a Saturday afternoon. When I went, I took several of our residents here, our family medicine residents, with me. And what I didn't know is that the meeting had been co-opted by the Tea Party. And they came out in force. They were angry, they were upset with President Obama. In fact, I was struck with the anger, the lies, the myths, the racial epithets. I was shocked to see my fellow citizens acting in such an angry fashion over something that actually impacts us all in very positive ways. The lies and myths around death panels and rationing and governmental takeover, as opposed to what could be done to help people have better lives, better health, and for those generations to come. And when I was walking out of there, I said to my wife, "Oh my God, I can't believe this. I just am shocked." And so again, she said to me very profoundly, "So Ted, what are you going to do about it?" It was at that moment that I decided that I was going to write this book, with the purpose being to better educate the American public as to what the issues are, so that the American public can be better informed, less afraid, and start to make the right decisions around healthcare that affects all of us. I learned that what we don't have is a healthcare system, but a wealthcare system. There are a lot of forces in play that want to keep the status quo just as it is to generate income. And that bothers me a bit. Not that we all can't make a living, but what we should be in healthcare for is to try to help people have better lives. It shouldn't be about us. It should be about them. I'm trying to get the message across to anybody that will listen, but most importantly, the American public. I want the discerning, intelligent American public to become more aware of what the problems are. I contend that there is a lack of education and a lack of knowledge about our healthcare system. For instance, I've heard for too many years that we have the best healthcare system in the world. Well, that's not true at all. And in fact, we rank 37th in the world for our healthcare outcomes. And when it comes to a fair, just, and equitable system, we rank 54th in the world. And I'm shocked for a nation as brilliant as I think America is, that spends more than any other country on the planet on healthcare, in fact 4 times the European average, that we can have such a disconnect in our healthcare system. We truly have a have and have not system where the rich can get what they want as soon as they want it, but where the poor live sicker and die younger. It became an issue of social equality for me. Winston Churchill once said that America will always do the right thing after it tries every other option. And I think that's where we're at right now. We're trying all sorts of fragmented, unaccountable, non-integrated approaches to healthcare. And what I am passionate about is that if we focus on good primary care, if we focus on access to healthcare, the right people going to the right places at the right times for the right reasons, that we're going to help a whole lot more people in the process. What I'm hoping is that we'll start to focus more on health than focusing on disease. We have a distorted way we're looking at healthcare. We're looking more at disease care. We're looking at sickness care. We're not looking at healthcare. What healthcare would do is keep people from needing all these things downstream. It's like we've built the best fire department in the world. We have all these hooks and ladders and fire engines, and we fight fires like nobody else. But nobody's asking the questions about what's causing the fires. How can we prevent the fires from happening? That's the focus of this book. That's what I'm trying to do. This whole concept of the patient-centered medical home becomes a metaphor for everything I've been talking about. It is a place in which integration and coordination happens because you know a patient over time. Continuity happens, a relationship develops. If I know you and your family and I've cared for you, I've delivered 2 of your children, and I've cared for your husband and your kids and you, then you trust me. And if I can integrate then your care in a way that focuses on keeping you healthy, not doing things to you, but keeping you from necessarily having things done to you that you don't need, that's very helpful. So for instance, Molly, if you came to me with a headache, and I've known you for 10 years, and I know that sometimes when stress happens to you, your headaches get worse, there's going to be a very easy relationship with me and saying, Molly, I've checked you over today. I think everything's looking good. This doesn't look like a cancer or a brain tumor or a stroke. I think you're going to be okay. I think it's stress related. Let's watch this a couple weeks. If you notice X, Y, or Z symptom to happen, let me know. But if I don't know you, Molly, you come to me with headaches, or you come to me in the emergency room, you're going to get all sorts of labs done. You're going to get a CT scan done of your brain, and the reason you are is, 1, that's what the system will pay me to do, and 2, liability-wise, I don't want to be sued if I miss the 1 in a million brain cancers, and so I tend to overdo, as opposed to having the relationship and the focus through the patient-centered medical home help sort out the right thing to do for you. And so the patient-centered medical home concept is something that I think MedMan must be all over. It's that integration and coordination of care. It's how to use the electronic medical record to keep data clear and to keep it integrated. It's how the consultations in the community work to keep it all integrated and coordinated so that the focus can be on the patient, not on the practice. What do we do to keep you healthy, to keep you intact, to keep your family intact, to keep your costs under control, to provide you timely access? So those concepts are what I'm going to bring to MedMan in the sense of the patient-centered medical home, continuity of care, the importance of relationships. It's all about access. So short-term and long-term solutions, as well as I talk about 31 different areas of starting to heal this fractured system, any one of which will improve our healthcare system. If all 31 are done, will absolutely transform our healthcare system. So it's been a labor of love. I'm excited about it coming out. I think that it will be well received in America. There will be some that absolutely see this as not being a right answer, but I think the majority of people absolutely will.